Hi, I'm Heidi Toby, Director of Social Work Programs at Therapist Development Center. If you're a first-time viewer and looking to pass your social work or MFT licensing exam, or just interested in topics relevant to clinical social work and psychotherapy, you've come to the right place. If you like it, be sure to subscribe for updates. You can also sign up for our complete LMSW, LCSW, and MFT exam prep programs by going to our website at therapistdevelopmentcenter.com or click on our logo. In last month's ASWB Exam Prep blog, we covered the topic of consultation with colleagues. We discussed when to and when not to choose this answer option on the exam. Sometimes the exam will present you with both the answer option to consult with colleagues, as well as the option to seek supervision or to consult with a supervisor. When this happens, which should you choose? And in what other scenarios is seeking supervision appropriate? Consult with colleagues or seek supervision? Which is best? When it comes to the answer the ASWB is most often looking for when consultation is needed, it is to consult with supervisors. Very rarely will you see both answer options available, with the correct answer being to consult with colleagues. The only times this would be appropriate is 1, if the colleague specializes in an area the social worker is needing support in, or 2, the question stem specifies that the social worker does not have a supervisor. Otherwise, you want to go with consulting with a supervisor or seeking supervision. When else do we seek supervision? Seeking supervision is a great option when a social worker is experiencing a values conflict or countertransference issue. It is also a good answer option to go with when the question stem indicates that the social worker is unsure of how to proceed. Whether the answer option is to consult with a colleague or seek supervision, keep in mind you only want to choose these answer options when there is a reason to do so. As we discussed in last month's blog on consultation, you don't want to choose these answer options simply because they're available. Similarly to our real-life clinical work, we don't seek consultation or supervision on every client situation, only when it is needed. ASWB practice question. A social worker meets with a new client presenting with issues of anxiety and depression. During the initial session, the client shares political views very different from the social workers. What should the social worker do? A, seek supervision. B, consult with colleagues. C, treat the client without bias. Or D, refer the client to a social worker with more similar political views. The correct answer is C, to treat the client without bias. This is a situation where there is not a reason identified in the question stem to do A or B. If the question had stated that the social worker felt frustrated toward the client or in any way felt unable to treat them as they would any other client, then A would have been a good step. But as the situation is written, it's not needed at this time. There's also no need to do D. There are many instances in which we will treat clients without similar viewpoints to our own. This does not inherently warrant a referral to a social worker with more similar views. Thanks so much for listening. Remember, if you're studying for your exam and looking for the best LMSW, LCSW, or MFT exam prep program, please visit our website at therapistdevelopmentcenter.com to sign up. With a 95% pass rate, we offer the best study system on the market to help you pass your exam with confidence. Here at TDC, we're with you until you pass.